extension from primary long tumor arise from muscle, fat, blood vessels, nerve sheath, cartilage, or bone of the chest wall, or via dissemination of malignant foci present elsewhere. So pain and awareness of the lung in the chest with cardiac and respiratory disorder are the most common symptoms that are present. Chest imaging with the tissue biopsy is crucial to reach a definitive diagnosis. As we can see on the left side of the pictures, there are the two film chest X-ray and the CT scan, which shows chest wall tumors. And those who requires after diagnosis of chest wall tumors, neoadjuvant chemotherapy should be advised. So a similar case with a right-sided chest wall tumor, which was about 10 by 10 into size, and we advised for 4 cycles of neoadjuvant chemotherapy, and the size is significantly reduced. So the methodology of my study is, it was a retrospective study done in 2 years from January 2021 till 2023 in Dulika Hospital. All the cases who underwent surgery for the chest wall tumors were included, and variables such as outcome of the surgery, hospital stay, neoadjuvant chemotherapy, and post-excision chemotherapy or radiotherapy, and recurrence of the tumor were also included. So in procedure, in all cases, tissue diagnosis was obtained by core needle aspiration or incisional biopsy. After resection was performed, at least 2 centimeter after the diagnosis, the surgery was performed maintaining the 2 centimeter free margin resection. An extension of the resection was considered sufficient when absence of the neoplastic involvement was demonstrated with frozen section of the margins. And the reconstruction of the chest with Prolene mesh with true layer technique with bone cement sandwich technique were done to all the required reconstruction and to prevent the chest collapse. So this was one of the representation of the case that we have done. So starting from the left side, the planning, this was the case of Ewing sarcoma, and which was involving rib 4 and 5. So we marked superficially the marking of the ribs, and then after resection, we can see there is the attachment of the tumor on the 4th and 5th rib, following which we resected the tumor along with the rib above and below. For this case and other cases also, we've done a double Prolene mesh technique, for which sandwich technique with the mesh up and below the bone cement was used. On the right side, we can see there is a fixation of the bone cement with the use of Prolene 10. So all the cases at the discharge were reviewed for wound healing, and the patient was referred for oncological therapy or other follow-up treatment. At follow-ups, patient was assessed with chest X-rays, wound healing, clinical and pain assessment were measured with visual analog score. Follow-up data were obtained by telephone calls or directly to the patient or during patient follow-up in outpatient to the cardiothoracic vascular surgery. So this was the case of right-sided chest wall tumor for which neoadjuvant chemotherapy was done, and size was decreased. And on the last X-ray, we can see there is a significant reduction of the expansion of the lung. So total 20 cases were done in two years of span, among which 42 years was the mean age group. Female was the common group, and the left side was the most common site. Chest pain and swelling were the common presentation, and average size of the tumor was 4.8 plus minus 1.6 centimeter. So in our setup, neurofibroma was the most common histopathological report that came after excision of the chest wall tumor, and following which schwannoma, Ewing sarcomas, chondroma, teratoma, hemangioma, and carcinoid tumors were shares all the other cases. This was one of the Ewing sarcoma SP report. So 2 patients with Ewing sarcoma received a neoadjuvant chemotherapy and other post-surgical excision chemotherapy and radiotherapy. So one was the recurrent in neurofibroma on the left side, and all the cases average hospital stay was 7 days. So the take-home message is that chest wall tumors are not a common tumors. However, a proper vigilance with a clinical examination and radiological examination is must in a patient having respiratory symptoms and chest pain. So the aim of the presenting this topic is like the chest tumors or chest wall tumors are very rare, and as Dr. Sampurna sir said, that we need to be very vigilant in case of what the patient presents with. the case that I presented was, it was a 21 years female. She had a cough and fever for 6 months, and she visited nearby hospital, and nobody did a chest X-ray. And after 6 months of not getting any improvement with the antibiotics, she had an X-ray, and X-ray showed a huge mass on the right side. So the take-home message is that proper clinical assessment and a simple chest X-ray can rule out chest wall tumors or any lung pathology.